All right, so I have a patient here that we did a couple of root canals on, and she's so thankful that we did the root canals because we were able to save her teeth. But she had some interesting things to talk to me about when she talked to her physician. So
Yeah, so I recently went to my primary care physician, and the year before I had mentioned that I was having some teeth issues, I should say, and she said, well, let's follow back up in a year. And so in that time, I came to see you, which, by the way, you've been the absolute best. But we did 3 root canals actually in a matter of 2 weeks, and it was a lot of work. But I mentioned to her on this recent visit that I had just had all of my root canals done, and I was super happy, and everything's been pain-free, and I haven't had any issues. And she said, oh, well, there's actually been articles lately that you really shouldn't put something foreign in your body. And it made me think. But then I said to her, so would have it been better for me to pull all 3 teeth? I'm 44 years old. I still have a lot of time left, and I'd like to keep my teeth as long as I can. And she said yes. So it really just
Amazing.
it blew my mind, and I had to bring it up to you because I'm sure you've heard of it before.
Yes,
But I
yes.
had never heard a primary care physician say that to me.
yes,
So, here we are, 6-7 months later,
yep.
and
Still
so
have
much
your
better.
teeth, doing
Yes.
well, and this is the thing that we want to try to demystify. It's important to save your teeth, and root canals save your teeth, and they are also ultra safe, because the only other option is to take the tooth out and then you have to get an implant. Well, an implant is more foreign than the tooth that you were born with. So root canals save teeth, and they are very safe. And hopefully I can send your physician some information and try to convince her
Yes.
otherwise, because like I always say, if you have a splinter in your hand, let me ask you this: would you remove your splinter and keep your hand? Would you cut your hand off? Well, obviously you would remove the splinter and keep your hand. Same thing with the tooth. If we can do a root canal, that's a very simple procedure. The way we do it as a root canal specialist, and save your tooth, why not keep your tooth? And it saves you time, it saves you money, and it's also a non-surgical procedure. And so with the technology we have, like 3D imaging and things like that, we're even more predictable and more pain-free than ever before. Thank you for sharing that testimony. It's going to help a lot of people out
Well,
there.
thank you.
Yeah, my pleasure.